So, yeah.
Social media generation.
Okay, so good afternoon, everybody. It's a short audience, but I'm sure it's a very active one. We need it because of the weather. And after a meal, it's always difficult. So my name is Maria Oliveira. I'm business director of UPTEC, which is the science and technology park of University of Porto. We have been here since 2007 and helped incorporated more than 650 startups. So I have here with me 4 distinguished guests. They're going to talk about technology innovation in health. Each of them will have a presentation like 12 minutes, and then maybe we can have just quick questions if you have it. Otherwise, we will move into the debate. So I'll start presenting Miguel Amador. You want to you'll be here? So, do you have your presentation? Yes. So let me just say, Miguel Amador is currently the business creation lead for InnoStars, Portugal, Italy, Poland, and Hungary at eHealth, a consortium of over 150 partners from leading business research centers and universities from across the EU. He's also the founder of PI Ventures, a startup builder supporting innovation in digital health, building several ventures ranging from artificial intelligence for diagnostics to regulatory technology for digital health and decentralized data. Is that okay, Miguel?
Yeah. Just put the timer so I don't go over time. So first of all, thank you for inviting me and share a little bit about digital health. This is a topic real dear to eHealth in the sense that it's really interesting when we look to Europe and we think that we are in a single market. At least I was taught in school about this concept of single market, that we are all of us should have access to the same things, but the truth is healthcare is still one of the things more compartmentalized in Europe. And if you think about COVID in the sense that, okay, hospitals work differently, management works differently, the truth is that even digital tools, everyone uses Facebook around Europe, but each country has their own telemedicine system, their own health data system, their own system of connecting with the data. And this shows the challenge of digital health around Europe. So eHealth has been working a lot on how we try to mitigate a little bit these challenges, bringing together all the ecosystem, all the stakeholders. And to tell you a little bit what is eHealth starts, the only slides of publicity, let's say, just to tell that eHealth is a European network of one of the best innovators in the area of healthcare. We are present in almost all countries with partners. So we are public-private entity, financed by EIT, that is a public entity from the European Commission. And we have this mission of first building unicorns in healthcare out of Europe, but also how we make sure that those unicorns can actually grow in the market. It can be comparable to the US, otherwise people just go to the US. So this is a quick vision of eHealth. We work a lot on different pillars, including education, innovation, and business creation. But just to give a frame of why I'm bringing a little bit the insights of what we're seeing on innovation in healthcare. I always like to start, and I'll now speak a little bit about the innovation in the digital health space, about what is actually digital health and how it becomes often so difficult, not only across Europe, but even for a hospital to adopt a technology that we are using probably 20 years ago. Like when you speak about telemedicine, for instance, we have a good example here who, like I'm 33 years old, so I use Skype for ages. So, and probably today I still struggle to get a telemedicine appointment with my doctor in the public healthcare system. And we need to see the evolution of healthcare in the past years, because we start with this concept of medicine based on human touch. So in the early of the medicine is really actually people touching or seeing the others that were actually how medicine was done. The past century, we see until 30 years ago, the evolution of technology in the sense of expanding the sensibility. So if you think about an X-ray, it's not more than a way of seeing inside the body. So you're just expanding the vision of someone. The stethoscope is a way of amplifying the sounds. If you think the majority of the devices, technology in healthcare was actually a way of expanding the sense of the medical doctor. You are not doing much than that. But when you start looking at digital health, it's not just how you connect people and see people across the world, it's how you use computers to start making them thinking that doctors do. And it becomes a struggle because doctors become more difficult for them to understand what's happening, because you can see if there is like a bowling ball inside the body on an X-ray, you can look to the person like there is no bowling ball here, like this does not make sense. But how can you as a doctor make sense of a diagnostic of Alzheimer or Parkinson that is computed by a machine? Is it true? Is it reliable? And this is one of the main struggles of digital health today. So we cannot forget, when you think about health technology, it always needs to achieve one of these three goals, the three goals, that is either it improves outcomes, so how you can actually deliver better health, or reduce costs, because we don't have money to treat everyone to the best, so we need to reduce costs, or increase access to healthcare. So it's not only having better healthcare, is making sure people that do not have access to healthcare have access to it. Often look into innovation always as a way to combine these three. So I'll try to be a little bit quicker on time, just giving an example of telemedicine is one of the examples I have here, not because we have a speaker on these fields, but how Portugal actually was a pioneer in these fields for more than 20 years ago, but still you don't see a lot of this being implemented, and a lot of the challenges related with fundamental issues on the organizations to be prepared and ready with the technology, with the readiness of people, understanding how things work. And still today, we still see struggles of adopting this technology. And what the point I'm bringing here is that actually in healthcare, technology takes a lot of time being adopted. And this is one of the main challenges in innovation, because we look into we see innovation today, we think, okay, this should be the future tomorrow in healthcare, but the truth is, like, electricity in the US took like 30 years to reach 60% of the population. And this was electricity, quite a common thing. And if you think about the MRI machines, it took 40 years to become a standard procedure for diagnosis. Now probably you can find the MRI machine in almost every neighborhood in the major cities. But back then, probably 10 years ago, you need to go to a big city, like everyone was coming to Porto to do an MRI and these kind of things. And this is a technology that took 40 years to evolve. So when you speak about digital medicine, health, often we're speaking technologies that this takes time to be adopted. It's not the technology, the bottleneck. Often we cannot forget this, the adoption curves and the hype around of a lot of the technology, because when we started thinking, okay, this will be the future of everything, telemedicine. Now the pandemic came, everyone will be doing telemedicine, no hospitals will be closed and so on. But now probably most of the hospitals are trying to go again and do things that could be done in telemedicine again. And you see the adoption of things and the hype around topics are something that you get a lot of expectations and interest in the beginning, but in the end, you got the disillusion of, okay, this technology actually will not deliver on things. And is when you reach the point of you no longer speak about the technology, it's simply there. How many things probably you don't even notice that today exist in your healthcare is when actually you find this path of enlightenment or plateau of productivity when technology is simply there. So it's when you stop speaking about things that actually they are there working, but we need to understand this hype curve. So we manage expectations and we keep pushing for things and understand what probably may not be the solution for everything. If you look a little bit, just a quick slide more for reference, how we look into innovation and how we combine today. Innovation is often a mix between what is a more digital analog service and different kind of clients and delivery of information. And if you put together these, you get different the different business models you can build around health, and almost none of this is focused on the technology. There is a lot of things on innovation that go beyond technology, that go more on how you deliver, to who you deliver, how you generate money. So data, for instance, is something that a lot of people speak, but not so many people do money these days. But there is always this kind of idea around innovation in healthcare. So just to finalize and bring a little bit a topic of this question that I think is relevant to go to a specific topic is, can AI be a diagnostic tool for dementia? So it really struggled doctors to be able to diagnose someone in really early stage. Can AI really be the solution at panacea for these kind of things? And bring a little bit the state of the art to start seeing that the majority of this is the AI solutions approved by FDA in the US. So giving a notion of how much AI is already being approved and authorized to be used in clinical care. And a lot of them, like the big blue part in the middle, is actually imaging. And a lot of the AI is actually focusing on the imaging, processing imaging. So being able to see that the patterns that the human eye cannot see and cannot compute so easily. And these are the kind of examples of how AI can support people. On actually extending the human brain, as I was saying in the beginning. But if you look into this, okay, so now you don't need doctors. Like the AI will diagnose everyone. You just need to pour the images through the AI. I bring you here a little bit what is actually diagnosing Alzheimer with imaging. And this is a way of seeing what is the using deep learning models to identify common patterns, common areas where a dementia person actually have typically some lesions in the brain, compared with the specific patients in the left. And then you have this mapping and you start seeing, okay, these patterns are repeating each person, and you can identify. And this is actually what a doctor tried to do often, and what the machine is trying to do is going to more fine detail. But the truth is, when we look into really clinical data, is when we start seeing a lot of these digital health tools, this is not about better outcomes necessarily. Often is about better access. Is for you to being able to deliver the performance of the best doctors, probably from Stanford or Harvard, or this kind of fancy schools, or Medical University of Porto, best doctors, to probably someone that is in a rural area, or is in a suburban region, or a small city around the world. And these around this, when we speak about digital health, and this is a concrete example that when we look to AI, we often think, okay, AI will replace doctors, but the truth is that what AI is doing is allowing any doctor to be the best doctor in the world, because they use technology to deliver the best outcomes available, but improving the access or decreasing the cost, because for you to travel to these places to get the best outcomes will be quite costly. So it's around these kind of topics that in some way a good example of how digital health can actually change things if you focus on the outcome you're looking. Often it's not the best performance, is necessarily the best access in some way. So we had a report on eHealth that shows exactly this, that the AI will not replace clinicians. Actually, clinicians who use AI will replace those that are not using. So a lot of the challenge on digital health is how you change people, change mentalities, change actually how healthcare works. So this is a short presentation, and thank you for following it.
You have any specific questions right now for Miguel? Well, that's one there.
That in the end, are the two different points. One is how digitalize the healthcare system. That's a point. How a city like next to us here in Vila de Mouros, University of Minho just implemented a program of bringing digital technology to a rural village to make sure that people, for instance, had access in the pharmacy to digital tools, and it was integrated in the way they were having. The point is how you bring these digital tools to the front line for access, but then those digital tools allow you to have the best outcomes, because that's the point. You don't need to come to Porto to have a diagnostic of Alzheimer. You can go to probably to our family doctor because he'll have the tools to deliver that early diagnostic without having experts, psychiatrists, neurologists, sorry, looking into it. So it's a little bit these two challenges. One is how you develop the technology and deploy the technology, but the effort is how you change the access to digitalization. That's what I was saying. A lot of hospitals still today, they start implementing telemedicine, but then now they try to do physical appointments again. I don't know why. Like if that was working. So.
Can I answer? Because from my experience, and of course we sell software for telemedicine to hospitals, they are afraid that they try to cross-sell services to patients while they are physically in the hospital, and they cannot cross-sell while you're away.
I'm speaking public, not even private hospitals. So the ones that
the public ones can only develop incredible technology by themselves, so they don't need other kinds of technology. So that's different.
Yeah.
Thank you very much. We'll have time for more questions at the end, but you see already there is some debate going on. So I want to present right now José, which is going to give a talk about telemedicine. So José is the co-founder and CEO of NOC Healthcare, and his goals include empowering every person on the planet to have access to quality and affordable healthcare. José has a degree in management from the University of Porto and a mergers and acquisition program from the University of Chicago Booth, and he is fluent in a lot of languages. Wow.
All right, thank you. Hi, everybody. Thanks for having me here. So just a little something about NOC. So why do we exist? And I promise we did not prepare the presentations before, but it looks like it. So basically, we exist to lead and humanize digital transformation of healthcare. And we need to be clear about this, because it's not good enough to develop incredible software to deliver incredible service. You need to be able to explain all the ecosystem of healthcare, how that works. And that is, I would say, the most important thing sometimes on our job. We focus on augmenting telemedicine, and the first part of my presentation is exactly on what augmented telemedicine is and why it's different from telemedicine normal. A few numbers about NOC. So we've performed over 250,000 consultations. Right now, we're doing one every 3 minutes, 24 hours of the day. We cover more than 5 million people in 12 countries, and we are growing at an incredible pace for 3 years in a row, and we plan to keep that speed of growth. We have a number of quite notable clients, most of them, of course, still in Portugal, but we have already important presence in Brazil, Mexico, Colombia, Chile, and Spain, and preparing France, Italy, and Belgium. And so what is augmented telemedicine? Why are we different? For us, augmented telemedicine is the remote medicine that uses data to empower doctors for better diagnosis and continuity of care, ultimately improving in patients' lives at a lower cost. How does this work in practical terms? Telemedicine, we use AI for triage and for gathering of vital signs. We capture data from connected devices. We use tools to measure how patients are feeling. And basically, we're now working also in collecting lab and analytics data in order to increase and to enrich our data pool. Okay, I would expect this slide to be a little bit clearer. Basically, how do we do our thing? We have an integrated patient journey that in one single software, we can have all those features that I just told about. So AI and human triage, a scheduler, remote vital signs, the actual video consultations, an electronic health record and e-prescription, and some prompts, prems, and scores, which in order to become more powerful and more relevant, we are now basically translating into verticals of care. What is a vertical of care? Is a certain combination of this patient journey where we have acute primary care, which is kind of what people are used to telemedicine, but we now have verticals on mental health, hypertension management, elderly care, and we're now preparing some new verticals. And basically the magic of all of this is that you put the doctor, we say we give superpowers to doctors. Ultimately, that's what telemedicine, augmented telemedicine is about, is think Tony Stark, if you see Iron Man and you see the screen and all the powers that he has. And this is exactly what we're trying to do, to give so much data to doctors that they have an incredible insight on patients that in most cases they would not have in a physical consultation. So this is the doctor side of it. The patient side of it ultimately is the same. The patient can use telemedicine, and this links exactly to the point that Miguel was saying on how we can use digital to close gaps in distance in medical deserts. The patient can be anywhere and they can still access all of those services in a very simple way on a tablet, on a phone, on a laptop. So basically for us, and this is another important thing, is what is augmented telemedicine and how is it going to work? Most people think of telemedicine as an alternative to phone. So basically they see it as Zoom on steroids. We currently already are not doing that. We are doing augmented telemedicine, which basically means gathering all of these data points that I've just explained and using them for improving the quality of the diagnosis and helping the doctor doing his job. But basically what we're seeing and what we're evolving our product towards is what we call the digital twin, the digital twin. And the digital twin is basically the capability of replicating someone digitally from what they are physically. And I'll give you an example here. This is very used in industries. And the question we're asking is, why not in humans? So I'll give you an example. This is the physical patient. That is a dashboard that the doctor can see about the physical patient. So those are all the data points that they have accumulated for the patient. And of course, if you do this really well, and of course, this is a work in progress, you will have so many data points that at some point you will be able to represent the physical person digitally. And that is the digital twin. And then, of course, the next step is what do I use the digital twin for? And basically for one very simple thing, prediction and prevention. So I measure a number of risks, a number of parameters, and I can say, this will be your future self if you keep up the bad work that you're doing. You don't exercise, you eat too much, you drink, and you will have a number of risks, and you have a number of augmented risks, which kind of make you a non-healthy person going forward. Or you can have a better version of you. We know what your risks are. We know how we can help you improve your behavior, how you can prevent some diseases. And there will be a future version of you, which is better than the normal you if you did not do anything. And this is for us is what the digital twin is and how we are developing the product going forward. Quick demonstration. So basically the product has 3 stages: appointment preparation, where we schedule, we gather, we do the triage and capture data, and we capture vital signs. The actual consultation, where we have the telemedicine, the electronic health record, and the prescription, and then the follow-up to the consultation, where we have a number of means to gather additional data. Very simple. This is the triage module for nurses. I will not spend any time here. This is the triage model for the actual patients. They go through AI and then they can schedule, pay, everything. The actual video consultation experience, super simple. A question that someone was asking, how will people that are not very digital use digital? Very simple. They can schedule the appointment over the phone. They receive an email or an SMS. They click the link there on the video, and they are gathering their vital signs, even if they don't know how to do it. And of course, then entering into the video consultation, getting the full experience, receiving the electronic prescription, where the doctor also organizes and gets standard structured information on clinical outcomes, disease codes, adverse effects, all of it in a super systematic manner. This is actual data from NOC. So this is very interesting because this has a physical application and the real application, which is the most critical thing. Most telemedicine softwares or operators don't know anything about their patients just because they just, again, it's Zoom on steroids. We gather so much data that we have incredible insight on patients, on cohorts of patients, on who the people are and how they are. Then, of course, the final part of my presentation, continuity of care. Again, we use a number of tools to gather data going forward and a certain client path, patient pathway. We're using one specific for elders, which is a little bit why we're here today. And I would say the most important thing for elders is a program that has 6 stages that I'll be happy to discuss afterwards. But I would say the key achievements are what I'd like to share here. Basically, with the elders that are in those 3 areas in dark blue in Portugal, these are over 300 people. The elders that we monitor or that we follow have had a 78% decrease in emergency usage and a reduction in 20% in hospital admissions. So see the improvement of quality of patients' life, see the cost reductions that we're delivering. Everything's through digital. A compliance rate of above 85% to all the planned assessments. So people understand why this is useful and they engage why this is useful. And of course, no dropouts and incredible other metrics. We gather, as I said, a lot of information which we share with everybody involved. This is super helpful for the people who are using the elders. Just some slides on how we can adapt to other existing players in the space. And I will just show again something on user interface. So this is the global health assessment. This is something that can be used for population management. And again, the population member will just receive an email or an SMS. They push the button, they answer some questions, they receive a score in real time. Why is this powerful? Because you understand immediately the reward of the questions that you have asked, and you understand what you can do to improve your health or what needs improvement. I'm not going to spend any time here just because there's really no point after all the explanations that we've given. So just to finalize, these are my contacts. Connect with me on LinkedIn, drop me an email, and I'll be happy to help. Cheers, guys. Thank you.
Thank you, José. Is there any specific, just one question for José?
Okay, thank you. So why South America, or why was it so easy apparently to penetrate in South America compared to other regions? Was it because of a market push on your side, or less competitors, more interest on stakeholders?
I think two answers, in fact, or 2 reasons. One of them is, I think South America, a lot of this resistance to change that Miguel has spoken before, it's much smaller in South America because they've jumped from not having anything to willing to use digital and to embrace digital as the only solution to the lack of doctors that they have and digital and healthcare deserts that they have. And second of all, I think there's a huge competitive advantage in us being European, because South Americans, regulation on data and privacy are not as sophisticated as they are in Europe, but sophisticated players in that area of the world understand the need for that regulation. And so when you say, I work in Europe, I do GDPR, I do a number of other things, European things, ISO 27001, blah, 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 it's a much easier sell than when you are competing against South American players.
Awesome, thank you.
Okay, so now from Wake. Not sure if it's MD, PhD, Chief Innovation Officer for Iceberg Consulting, He's also a serial entrepreneur. That's great. Having founded and currently operating an R&D company, a clinic and neuromarketing company, and a startup called Wakesy, a digital therapeutic for sleep and mental health. Is skilled in a lot of things, from business model to strategy, communication, and research, and has recently won eHealth InnoStar Service Excellence Program, and is a vocal advocate for digital literacy in healthcare.
Thank you very much. Hello, everyone. I'm Zaki. We probably don't know each other, but if you've been here in the morning and you saw the videos, it's my voice on the video. So basically, I already talked to you. Okay. That being said, my name's Zaki. I'm a digital health entrepreneur trying to bring a digital therapeutic to the market. And one thing I learned is that if you're trying to do that, you need a side hustle in order to be able to live. So I'm a medical doctor and I work as Chief Innovation Officer for a consulting company, the largest in Romania, except for the Big Four. I work in several digital innovation hubs. Then there's Wakesy, the startup. I have a clinic and 2 companies, one in R&D and one in neuromarketing. Thus making me, what do you call it? Serial entrepreneur. Okay, let's talk about Wakesy. It starts from the problem that people sleep bad. The CDC even considers there's a sleep epidemic out there. There's a lot of money lost in lost working days because of productivity. And we also conducted our own research, and turns out 4 out of 5 people sleep bad and wake up feeling tired. And also bad sleep has consequences in physical health, which is why we thought of a solution, which is a mobile application. I don't think I'm staying right next to the microphone, sorry. So we're making an application for smartphones and smart wearables, such as Apple Watch, smartwatches in general, that the app makes the watch vibrate, thus influencing the electrical activity of your brain as you sleep. And this enables us to do a couple of things which are really cool. First, help you fall asleep by inducing a slight hypercapnia, so increasing the CO2 levels in your brain, making you a bit dizzy and helping you fall asleep. Then as you sleep, we can make your sleep deeper or lighter. And most importantly, or let's say this is our first selling point, is that in the morning before your alarm goes off, the application superficializes your sleep so that you have like a gradual natural awakening, eliminating the problem of people waking up tired in the morning. Of course, you need some eye candy in an application. So we did something called Sleep Wisdom with a bunch of, articles and practical advice to better your sleep. Obviously, by sleeping with a wearable on your hand, you generate a large amount of data, which we also offer to you interpreted. And I mentioned the lullaby protocol, the thing that induces hypercapnia to help you fall asleep. It's like a Buddhist technique, actually. So we're supposed to sleep for a third of our lives. We initially set off to market a digital supplement for $10 a month, and that didn't work out well. Although the sleep market is pretty large and always increasing, we noticed some cool stuff. One of them is that almost a quarter of sleep tech solutions right now address sleep apnea. And then the latest generation of Apple Watch has a pulse oximetry, which enables us in turns to diagnose your pre-apneic episode, do vibrations so that we make you change your position and hopefully avoid the apneic episode. And while not, curing the disease, we improve the quality of life and postpone the moment when the patient suffering from sleep apnea becomes dependent on a sleep mask. And this is actually the coolest thing. We figured out we can do a digital intervention to influence the metabolism of serotonin while you sleep, thus creating a digital therapeutic for depression. Depression is a widespread disease. By counting the people in the room, I know we're not many. Chances are at least one of us is feeling depressed apart from me. It's a serious disease. It actually has a 5-fold suicide risk. And only in the US, it costs $210 billion per year in lost productivity days, plus the strain it puts on the medical system. And you know, it's a large market, of course. There's 3 existing treatments. There's antidepressants, which are pills you take. There's psychotherapy, which is something that takes a long time. And then there's transcranial magnetic stimulation, or TMS, which asks you to go to a place where they apply this thing to you. It's a big device, so you can't really have it portable. And here we go to what Miguel said in the beginning, that medical technologies have to make things more accessible, cheaper, and improve outcomes, which is what we set out to do by using REM pressure, which is a thing validated in the 70s that implies eliminating REM sleep from your diet, which will in turns inhibit the reuptake of serotonin, which is what the antidepressants do today. And as I said, it was validated in the 70s. However, they did lack the technological means to implement it at a large scale. And then we go to what Elon Musk said, remember the future, which is what we try to do using current technology. And thought about marketing a digital therapeutic, well, still a digital supplement, because we need a lot of MDRs to be actually a digital therapeutic for, we suppose, $20 a month. And where available, we plan to have this reimbursed by insurance. And this project got funded by EIT Digital with 25,000 euros this year. And we also got accepted in something called Wildcard, which is, I think, the largest healthcare innovation competition in Europe, with a 1.5 million euros cash prize. And, you know, being a digital health entrepreneur trying to make a digital therapeutic is, I think, a debilitating disease somehow. We started as students. We did this in a university competition back in the day. We won a lot of trophies along the way. We even presented it as a research project at Stanford Medicine X. But at the end of the day, we are still struggling because we don't find the right means to go forward. And the ecosystem we're part of is somewhat of the problem, because, you know, most of its efforts are concentrated in the ecosystem itself and not in helping the innovators somehow, or in helping the innovators as a framework and not as individuals. However, I think the Connect project is something unique in terms of boosting the potential of an ecosystem through the fact that, as far as I know, at least in risk countries, we don't have a dedicated, validated educational curricula for digital health, and now we sort of have one. And the people making Connect have decades of know-how and open innovation that translates into, hackathons and competitions, and the know-how to do those things, which is extremely valuable. I call it ego neutral because I said ecosystems are like a wolf eat wolf kind of place. And the fact that it's mostly university driven makes it less egotistical. There's a network building around it. My role is somehow a business liaison. So I try to bring, business people to the project somehow. And then we kind of hacked sustainability through using the educational curricula in Connect in the European digital innovation hubs to happen in probably next week. We also got a bunch of cool partners. We worked with 2 universities, a couple of companies, so on. We have an advisory board. This is our team, really, like the founders of the project. And we have a few medical experts and about 12 engineers. And this is my takeaway message, that digital health entrepreneurship, in the deepest way of doing it, to do a digital therapeutic, in my opinion, is the ultimate game. And I think that for the future generations, at least, you have cheat codes with this by taking some of the learnings from the older people who went through this and failed miserably, like me. So yeah, thanks.
Thank you, Zaki. Is there a question for Zaki? Okay, so we'll hear more about you during the debate. So I'll call now Ion to talk about startups in the healthcare ecosystem. So Ion is the Director of Innovation and co-founder of Fresh Blood Health Tech, which I really like the name since it's in Transylvania. Is being graduated on human medicine at University of Medicine and Pharmacy in Cluj-Napoca. Not sure if I said it correctly, in Romania. He's been active for 15 years in the healthcare business field with growing responsibilities and impact in several multinational companies and in entrepreneurial projects. Since 2016, he focused on improving healthcare through innovation, supporting startups and innovative projects as co-founder of Fresh Blood Health Tech.
Yes, can you hear me? I will take advantage of the fact that Zaki is not in the room, but actually I will start with two keywords which are connected with what he said. Two things. First of all, the ecosystem is important, and now it's not about the wolves. You have dinosaurs in the ecosystem. You have snakes. You have eagles. It's a very complex ecosystem, but I will touch with that. And the second thing is ideas fail, people don't. I don't have this on my slide, but whoever ever tried something actually progressed. The project might not have succeeded as planned, but it's just part of the path. It's very challenging to speak at the end. I will try to be quick and stick to the timelines, and I will try to convey a couple of conclusions about what are the roles of healthcare of startups in the healthcare ecosystems. And Zaki said that startups are few, but I would say that the startups are the small piece of wood that actually change the things sometimes dramatically. And this, if I would use only one slide, this is the slide that I would like to use, because this is where we are facing the healthcare, because the administration is always very happy with what they are doing, and also, of course, the doctors say that we are very busy, and whenever the innovator comes to help them, he's in front of a situation where his support is ignored / discouraged. However, there is hope. That's a little bit of my business card that I presented, at least 3 heads at any moment, but that's part of the game. And I would like to bring a little bit of Romanian wisdom with me. I don't know how many of you have heard about this guy. It's basically the equivalent in sculpture of Picasso. It's Constantin Brăcuș. He said one very important thing. He moved from the statue on the left, actually something like 25 years later, to the statue on the right. And the statue on the left is in the rain in Bucharest, and the statue on the right is worth tens of millions of euros. But he said something very important. It's not hard to do. It's hard to get into the doing stage. And I guess this is what we are trying to build here in front of the people in the room, but also in the front of the people that will see this afterwards, helping you get into the doing stage, because you are actually choosing to build a different future. And I have 3 things on my agenda: ecosystem, no pictures with wolves, but charts, startups, especially in health, and especially the solutions. Because people are not interested in telling about the problems. The world is full of problems. I'm sure that you are here because you are maybe looking for a solution, or maybe something that actually looks like a solution, but needs to be tested. The ecosystem, the pack of wolves, it's pretty much like this. And that's a 10-year-old picture where the ecosystem is made from 4 quarters of organizations and people that actually fighting each other. This is why I'm saying it's the jungle. And here we have 2 small things, which is Fresh Blood, which is one of the organizations, part of the ecosystem. And another small player, it's the startup. And you would say, yeah, but they don't have a chance. Well, you have a chance, but if you partner with the big guys. Asociația Init and Fresh Blood is partnered with Babeș-Bolyai University and with Porto University, which are some of the, let's say, I will not call them dinosaurs, but I will call them tigers of the ecosystem. So you need to be partnered with the tiger. Not easy, but nevertheless motivating. And then you're getting into the healthcare players, and healthcare players are very different from startups. And they will be powerful, they will be risk averse, they will be in competition to each other, because hospitals are always in competition, doctors are always in competition. And you should be aware about this. And they should be worried of something called sunken cost. I don't know how many of you learned this, but let's keep it like this. You studied for 5 years to get to a diploma, and I'm coming to you saying that your diploma is not worth as much as it was. How will you look at me? Am I your enemy? It depends, as always. On the other side, you have the startups, which are weak, at least at the beginning. They like the risk because this is what they try to change. They are willing to collaborate, and they have very limited sunk cost. So what do? You bring technology into the game. And technology actually is aligned with the healthcare. And one of the things we have seen in the previous presentation, technology coming from big companies, which were previously all startups. And Google is putting a headquarter nearby Mayo Clinic because Mayo Clinic is the #1 hospital in the world. And it has been like this in the last 50, 100 years, while Google has been around only for 20 years. So you need to respect the power where this is coming from. And even the tech companies understand they need to collaborate with the big guys. And you have here a very interesting list. Everybody is doing innovation, but they are doing innovation on their own terms. And the technology that we all have now in our pocket has been a major change, because everybody has access to technology. And when you have access to technology, you get ideas. And when you get ideas, you begin to use it. So the biggest telemedicine app in the world, I do believe it's WhatsApp, which is actually one of the benchmark that I'm sure that Knockier is using in order to evaluate the quality of their offering, because WhatsApp is on everybody's phone. And I was recently in a congress, and all the doctors were during the lunch break on WhatsApp, checking the messages from other doctors, from the patient, which means that they were practicing. It's funny, but this is it. However, at one point, there is somebody say, but there is a better way. And we have seen here the example of Knockier, when somebody says, look, there is a better way to do it with augmented and especially risk-controlled approach, because WhatsApp, you don't have control. Let's be honest. And then you have startup. And at the end, sometimes maybe the government will decide that maybe there should be some regulation if the problem is worth regulating, if there is enough money involved, or if the right people are involved. And this is how we appeared. We, as a bunch of people around the table, and for a while, Zaki was also part of our team, and we learned a lot from him. And as a supporter, we can no longer afford to pay him. That's one of the problems. Part of the game. And our philosophy is we believe that things are moving in healthcare innovation through three things: through people, through projects, and through partnerships. And here we started 5 years ago when I first met Miguel, and trying to meet the people that actually did things. And then we realized that maybe there may be projects to be done. And at the end, we are getting into a partnership where we are coming to Porto, learning things and also building things for the others. A little bit about the startups. I like this definition. There are plenty of definitions. It's actually a team that tries to solve a problem. The problem is the problem. And the problem is not the problem. The problem is the way you understand the problem. And that's already the subject of another half an hour presentation, but I'm not going to this. However, the startups are solutions for the healthcare context because they have the least to lose in any given situation. Most of the jungle of the dinosaurs or of the wolves or of the tigers would be very cautious about not only about things they gain, but especially things that they fear of losing. And the startup has the chance to actually change things because they have very little to lose. And I would say, Zaki said there are few startups, but when Zaki started 5 years ago, there were much fewer startups. And you see here Wake Z on the top scale. This is the Romanian health tech startup map that we are curating at Fresh Blood. Have not been able to identify one for Portugal, but maybe you can help me. This is growing, and not essentially what this is growing. The people that are working in startups are beginning to make a difference. So I'm having here examples like, for example, Atlas, which is working with hospitals, OncoChain, who is working with hospitals, actually helping them solve their own problems. Maybe I'm repeating myself. I do believe that through this project, Connect, we built a curriculum based on reality. We come from reality. I have not failed in 3 startups, but I have learned a lot in 3 startups that did not move forward. That would be my experience. And I brought this experience into the project. I brought this experience into the feedback that we can provide. And you will get part of this experience in the interdisciplinary session that we will have in July in Cluj-Napoca. And also, we are constantly working as a startup mindset, helping the people that want to innovate move forward. And this is a project that we got funded from eHealth this year. It's through the local capacity building. We realized that people that want to innovate have a limited access to doctors. And we said, we will make this access happen in a structured way, and the founders will actually get real-time feedback, because I don't have this slide. Maybe most of you know Dr. House. One of the quotes of Dr. House is, everybody lies. And this does not mean that everybody is lying to you, but everybody is saying whatever puts him or her in the best perspective in a professional way. So that's the meaning of that expression. We want to facilitate faster connection. And for the healthcare mentors, we want to facilitate interesting collaboration, publishing opportunities, and advising opportunities. Because I'm sure that Nokia has a number of doctors that they keep close, that they trust, and who are very motivated for a number of reasons. I'm sure that's the rule of the ecosystem. You need to have friends in the ecosystem. So if I would like have just one conclusion for you, and that's you might not necessarily want to build a startup. You might not necessarily want to be an innovator, but next time you are seeing a startup, next time you are seeing an innovative project, next time you see an initiative, my challenge for you, or take-home message, focus on the problem. And one of the things that I heard a lot is, I'm such in love with my idea. That's a bad way to fall in love. You should fall in love with the problem, because this would actually allow you to adjust, because the problem will change. The pandemic changed things, and it's still changing things. It has not been finished. We had to wear masks in Beauvais, in Paris. We had to have certificate. People that went to Germany did not have to show the certificate. So the world is still changing. And also one other thing, you might be young yet, but do not refrain yourself to think about the impact of the problem. Meaning, who is losing money and why and how much, and who would like to actually gain money and how much, in order to actually connect with the reality. And in this context, my advice is to find partners. And we say partners. It might not necessarily mean, okay, you are a young person and you want to build something, don't go directly to the professor. It happens, but in Israel. In Israel, the chief of service at Sheba said, anybody has an idea, come to me. I have always time for people with ideas. Straight declaration, public in an amphitheater like this. But find a younger doctor. Find somebody that you have as a friend, that you know that is a person that cares, and talk and find a partner. Find somebody which will serve as a Trojan horse to explain to enter the citadel and the context of healthcare. And from there, it will be faster, it will be easier, and you have a chance to actually scale, and to have a chance that people will actually use your solution. Thank you very much. You have my QR code, you have my details if you are care to look for me. We have a Health Innovators EU Facebook group. If you want to join, we are trying to build an English language community as well on LinkedIn. And I'm very happy to be here. I'm very happy to maybe meet some of you in 5 years telling me that this mattered. Thank you very much.
Ian, thank you. Specific question for Ian? Okay, so maybe we can start the debate talking about some issues. So one of the things that I wanted to ask you, because we talked about how we could make health more affordable and how technology could support that. But there's also one thing that has to do with the asymmetries of information. So normally, and I'm sure this happens to you and in different contexts, whenever we buy something as simple as a mobile phone, we look for a lot of information regarding the mobile phone. We see if it's cheaper, if it's faster, if it has different functionalities. This doesn't happen in healthcare. So normally our hospitals are very focused on the number of procedures, but not in the results, in the outcome. They are not evaluated by that. And as a patient, I don't get the information, or I don't look as much. So I wanted to hear your take on how technology could help to have more information for the patient. Ian, you can start. I see that you are already.
I would say very simple. This is a problem. And it is a problem that has a sizable impact. And hence, there is an opportunity to innovate. And I'm having a startup as an example of this. Startup that we are connected called medic.chat, done by 2 IT guys in Romania. We said, people are looking on Google, trying to understand whatever happens with them, and they are finding bad answers. Maybe there is a way to actually involve some doctors, provide proper answers, charge some money, and make everybody happy. It is happening already. So that's a way how a startup, because I'm a big advocate of startups, can contribute to the healthcare system, and at the same time doing good for the patient because the patient gets the right information, doing good for the doctors because the doctors use their knowledge that they accumulated, answering questions from the patient, and recruiting new patients. Because I have a doctor, gynecologist in Cluj-Napoca, which had 1,675 positive feedbacks. Guess what? That doctor is now a doctor that can negotiate with her employer, private hospital. Look, I have this legacy, and this is value that I can bring into the game. I don't think this is solvable as a governmental level. But this creates opportunities for people that want to innovate to build things of usage. And that would be my example. Usually, you know the quote, there is an app for that. I like to say that in healthcare problem, it's usually a startup. There is a startup that is trying to solve the problem and succeeding. Thank you.
Do you want to add on that? José?
Yes. I completely agree with the problem, and I think there are 2 things that are super important to solve the problem. One of them is access to your own healthcare information, which is one of the things that I did not show here, but it's the other side of the augmented telemedicine. The patient has his own patient timeline where all of his information is available, is exportable. And the second thing, and this is the one that's solvable at government level, probably at EU level, is interoperability. If I could ask for one wish at European level, is that we should have interoperability in healthcare data the same way we have interoperability in finance data. Today, there are protocols to communicate finance data. I cannot understand why we don't have the same protocols for health. The moment you have that, basically you are giving an extraordinary power to the patient. It's difficult to research because it's a closed environment, and I honestly don't believe that you'll ever get to put ratings on stars on hospitals. Even if you do put ratings on stars, you have to bear in mind that the stars usually is a measure of the quality of the experience and not the measure of the quality of the outcome. So, for instance, we are measuring outcomes, but it's an asynchronous process, whereas the experience measurement is a synchronous process. So it's hard to put public information on outcomes and on the quality of outcomes. But at least if you give the patient the power to control his own data anywhere and to share it anywhere, the patient has the power to move, and the power to move is a superpower for the patient.
Yeah. Go ahead, Miguel.
No, if I can add something, because you mentioned the cell phone and information. And it's interesting because in healthcare, we assume that people really want this. And that's the tricky part on healthcare, is because people are not seeking the kind of technology and healthcare. They are not seeking that. It's like, if I come to someone and say, do you want me to pay 5 years to explain you all the limitations you have because you are a short person, and spend you 1 hour saying how short you are and how you need to live with that for your life. And I'm just saying this because when you speak about healthcare, this is something people just don't want to care. And it is quite interesting because actually is not, there is not a driver often on the people and until there is really a need. And then there is a need, then comes more the urgency facts. And we rely a lot of the personal opinion, like the doctor is the one that is in
He's
the
a
end
god.
being paid. Yeah, he's paid to know all the information and deliver to us in that sense. And this is the limitation on digital health, because the same way we select a phone probably is not the same way we select a doctor.
Yeah.
Like, how many of you selected a doctor? You are going into how do you look for it? How do you thought for it? It's probably something that you just go where it's easier to get access when you really need it. Otherwise, we would try to forget it. And this is the issue of technology, because the apps probably most of it are not being used. And this is the adherence, the usage of the apps is the struggle of innovators in these fields. There's plenty of management diabetes apps out there. They don't work because people do not use it. And this is a challenge.
Yes, Zaki?
If I may just add one more thing to what was said. So indeed, don't always choose your doctor, especially if you're in a desperate situation. But when you can choose your, not necessarily doctor, but healthcare solution or provider, it's so much different than choosing a phone, because when you choose a phone, you basically choose something about a gain in your life. Like you choose, the eye candy, the design, all those features. I think in healthcare, or when choosing any sort of health solution, the most important thing, being it your health and your life, is that particular solution needs to have your trust. And in healthcare technology, more difficultly than in the healthcare provider, like a physical doctor, there is this problem of trust that goes two ways. It's all about the privacy and the security of your data, etc. on one hand, and on the other hand, it's all about whether or not that digital solution can provide the advertised benefits. So there's two levels of trust that you somehow need to cover as a, let's say, provider of digital healthcare in general.
And let's move a little bit, because we also discussed the democratization, the access to healthcare. And we still know that, for instance, in the US, one of the richest countries in the world, if not the richest, we still have like 20 million people without access to healthcare because of insurance. And then we have countries like Portugal, the UK, with universal healthcare, but we know that the access is not the same. Either you know somebody at the hospital and then maybe you can get very good healthcare, or either you wait forever to have somebody to talk to you. So how can digital technologies improve this, even at hospital level, or to provide, because we already saw an example with telemedicine, to provide to the patients an alternative, something which they can really have access in terms of cost and in terms of quality? José?
I have a very strong opinion on that. Well, I think digital allows for the simplest access to care, which is fundamental, and it addresses the distance, which is another problem with access. The third thing is, I think digital, we have a strong belief that healthcare will become digital first in, I don't know, 3 years, 5 years. i.e., you want to access healthcare, you will have to go to some sort of digital triage. Because one of the reasons why you don't have access is because hospitals and centres de saúde are completely crammed with people that do not need to be there if there is an alternative and a credible option about all of this. So that's one of the things about digital. The second thing is, and this goes back again to data superpowers, augmented telemedicine, is the more you empower patients to take care of their own health, and digital helps them deal with that, the less acute consumption you have of healthcare, and the less acute consumption you have, the better organized the system as a whole can be. When I showed there that we are working in care homes with elders, specific programs, and we managed with our technology to reduce by 78%, I think, the utilization of unprogrammed hospital visits. Mm-hmm. The most exciting thing is, and 80% of those visits that we have avoided, we used telemedicine, and it was the alarms from our system that warned the carers that people should be seen by a telemedicine doctor before using the actual hospital. So this is how digital is going to help. It will kill healthcare deserts. And second, it will improve the flow of the thing, the fluidity of the system by avoiding acute episodes and helping to plan things. And of course, this will make it cheaper and more affordable and simpler.
Zaki?
Yeah, so I was just looking for the name of the telemedicine company that I was trying to refer to. Do you know Babylon Health? Okay, so at a metro station in London before the pandemic, there was this huge, humongously large poster that said, it was like a middle-aged lady saying goodbye to her son, saying, I'm going to the doctor, back in 6 hours. Then 6 hours was cut with a red line and written underneath 30 minutes. So about the waiting times, I think telemedicine is particularly the answer.
But waiting times is not, access for me is not waiting times. It's so much more than that.
No, if I can on that, I think you picking the point is, I think we have two challenges. One is access to healthcare, the other is access to the healthcare system. And I think this is the struggle, because we have in Europe mostly a public healthcare system. In the US is a private healthcare system, but honestly is also a public one, because you need to get the insurance and then you go through the insurance, but accessing the insurance is a problem.
Yeah.
And there's the issue that we have on the public healthcare system in Europe is that if it does not is within the public healthcare system, we don't have access outside. So if you look countries like Portugal, just think about this journey of going to a private doctor, like go to NOC with telemedicine, and then try to get an appointment with a specialty doctor in the hospital, because you don't need to go to primary care for the same kind of thing. You cannot, because the systems are in some way themselves, they are limiting. So this access is a challenge, because nobody is paying for healthcare. It's actually is being paid by the systems, and the systems actually shape a lot of the innovation. On eHealth, we are working a lot now with the German, and we help to move to France on this, what is called DIGE. It's like a program to reimbursement of apps. Like we got an example here of the digital therapeutic. Why a doctor in Portugal, or actually almost all countries in Europe, can prescribe antidepressive medication that probably doesn't even work properly. So and he cannot prescribe an app that probably show clinical results and have proper approval, because the system itself often is lagging on the changes that are needed for innovation. These incentives to people, this way they do innovation. And I think we are not yet tackling how the healthcare system can be innovative and change to this to provide access and so on. We are still trying to think. Your image is the perfect one. We are busy. We cannot change. Like your picture summarized quite well the issues on healthcare. People are quite busy. They don't have time to change. We always did this like this way. We are not testing new technologies, even if in the future
it could help a lot. Yeah,
and it's a challenge.
I just wanted to comment on thing. Despite the fact that there is, let's say, misallocation of resources in healthcare, or there is a lot of limited access, there are a lot of things in healthcare that can be improved, a lot. And usually from the ecosystem, you don't see it too much. This is why I'm an advocate of startup, because one of the things that the startup has is a fresh blood, fresh mind. It's a fresh perspective. I like a quote, actually it's a Polish quote, to bring our friends from Poland here. The guest sees in 1 hour what the host does not see in a year. And bring a fresh mind to the journey of patient. And I like that presentation also of Nokia. And I noticed that the improvement. You need to understand the journey in order to choose where you put your money and your time. In many situations, we put our money historically. And I'm a doctor. I'm not that old, not that young. But I have seen dramatic changes in healthcare due to the changes in treatment, due to the changes in understanding of a disease. Sometimes you will be shocked if you read the history of medicine, but you don't. And the news is not based on history. My recommendation is, if you want to improve healthcare in any way, open it for startups, and startups will come and bring a fresh perspective and bring recommendations that will actually improve dramatically a situation in terms of access as well, because this is something that can be done. However, this requires political will. It's the magic ingredient of any healthcare improvement project, the political will. And when I saw in José's presentation, government of Portugal, that was a lot of political will. Thank you.
So, so in your presentation, Miguel, there was something that I found particularly interesting, because you said the technology adoption takes time, and then the cycles, whenever you stop talking about it, that's when it really is being implemented. But when you look back to a specific case like diabetes, in which you know since the 30s that you can control it and prevent a lot of problems because of that, and still, at least in Portugal, 60% of people have poor control of diabetes. Is this a lack of information on the side of the patient? Is this a lack of information on the side of the doctors that do not adequately adopt technology or advise their patients to adopt the technology, enabling them to do this?
No, that is interesting, because on eHealth, as I described, we work on innovation, business creation, and also education. And often the mandate from EIT itself on education part is mostly on the entrepreneurship. So let's teach young people to create new companies. But the truth, when we look to healthcare, a lot of the work we do for education side is how we educate people to actually be able to be the prescribers of these innovations. A lot is are the doctors that are not pushing for the innovations. They are the ones that need more change. Patients are there to willing. That's why they pay probably privately to go to knock instead of, they don't have an alternative. And this is a good proof, as a lot of the people are ready to adopt things. The doctors are probably the one more limiting, and we need to look into our education itself. I don't know who is educating new doctors even with digital health today. So how can we expect doctors that were educated 30 years ago to be now prescribing an app? Like, they don't. That's what I'm saying. When on my presentation, it's easy to convince a doctor that an MRI works and makes sense and can help us. It's not easy to convince a doctor that AI thinks better than they do. And I say doctors, even myself, like just convince me that AI could do a better presentation than I did here.
There's a lot of proof that's needed.
Like, trust, like now I'll send AI, you'll record my presentations, do a presentation like I do. I don't need to care. This in front of the Prime Minister, highly important people, let AI do it by and that's a tricky. It's a new level of change that I think we need to, is years of education still to change.
I want to comment on this. Very fast, we get into the blame game, and that's the easy game. Who is guilty for that? Who should be doing that? Who should be doing that? Who is not doing enough? Who should be educated? No, it's not this game. This is a game which is finishing very fast, because at one point you would say, you're guilty, you should be doing something, but actually nothing will change. While the game of the startups, once again, I'm a startup advocate, is who can contribute to that, to the solving this problem. And suddenly you realize that maybe there is more to be done, not giving things to do to the doctor, but taking some of the tasks of the doctor, which is doing them poorly, because he has not been trained for this. And I have a very simple example, which is called medical navigation. Some of you might have heard. There are specialties like oncology, where medical navigation is a person which is helping the patient deal with the system on top of the doctor. And it's not too much in terms of cost, but it had a tremendous impact. It is the same with the startup. A startup can help, but you need to understand how things are moving, not how they should be moving, but how you can improve them. And sometimes improvement of 5% is more than just pointing again, we should have 60% control, 90% control. No, let's increase the control by 5% in this particular. And suddenly you have a very, very different discussions. Yeah. Thank you.
And then again, moving, because we talked about startups, we talked about ecosystems, and according to the Boston Consulting Group, as much as 80% technology, digital technologies for health fail. And this is as much to do with the implementation, the translation from the knowledge into the market, and the bureaucracy, the barriers that they face to have this proof of concept. So in your opinion, if we could have instruments in place or different types of incentives, what should we do to help this translation? Ian?
Will comment, you jump with startups, I will come with startups and try to reframe it. Not 80% fail. 80% only result in learnings, not in businesses. 80%, actually 100% of the startups result in learnings. But 80% only result in learnings. The rest of 20%, maybe they will get impact, they will get a business, maybe get an unicorn. Congrats for Sword Health, by the way. That's that's the local behemoth. So I think, once again, we should be focusing on improvement, things that matter to improve. I don't want to increase the number of those who fail, but I want to increase the number of those who try.
And how do you do that?
By this, by connect, exposing the people to the knowledge that we have, to the understanding that we have. I like a quote. I'm a quote addict. Sorry, disclaimer. The master has failed more times than the apprentice has even tried. We need more apprentices to try more, and they will get masters. And we will not count the fails. Fails, it's statistics. We will count the impact. And I trust that the young generation has the tools for having an impact. And actually, I care about you having an impact, because in 20 years, I will need you. Thank you.
And Miguel, do you want to comment as well?
No, what I wanted to probably add here is a little bit again, I always come to the point of the incentives. So we speak about all about the ecosystem, what we're doing in the grounds, but a lot of the healthcare needs to come top down, aligned with incentives. So failure is good, but probably you should say to the hospitals, here's money, 20% of your budget to invest on things that will fail. So there was no expectation for this to actually succeed, but you need to invest this money and try to deliver these outcomes. Even often incentives. We had the incentives during the pandemic here in Portugal of telemedicine. So hospitals, Hospital was a public healthcare system. They got more money for each telemedicine appointment. So incentive to change. Like these small incentives is the way of showing actually to the machine, this is the way we want you to produce value. Of course, I don't like the incentive for telemedicine because it's not for service. But the incentives, like if you put really incentives to a hospital, like, okay, if you reduce 10% the control of diabetes in your population, like you have a baseline, in 5 years you need to decrease, you receive this amount of money. Then you put people looking for solutions. Because how can we achieve this? So often it's with like incentives. We just have a payment scheme that is continuation of the same often, and the incentives allow to stop the blaming game, because in the end, the point of the picture you had is the incentives. Those guys didn't have the incentives to stop and actually try to try everything else.
And Zaki and José, because you are co-founders of startups, and of course.
I was thinking of something I shared with my team actually this morning for a completely different reason. Yes, a quote from myself. And basically, I was saying that kind of when we present whatever we do to our clients, basically we have to be very clear on that our solution does one of three things: drive growth, save money, kind of real money, reduce risk, and I literally wrote last line, everything else is fluffy. And I think this is the ultimate incentive. This is kind of when you are a startup, you have to be very clear that your solution, this is why 80% only learn, because you have to be very clear that your solution does one of these three things. If it does not, because if it does, you are aligned with anybody's incentives. They all want to grow, they all want to save, they all want to reduce risks if they don't grow or save, because ultimately it's a saving at a different level. And sometimes I think people forget a little bit about this, which is what's the incentive on the other side. So for me, it's these three. growth, savings, or risk reduction. Everything else is fluffy.
And if I can, this growth, I think is interesting because it's probably easier to sell gym memberships than actually membership for about diabetes management app. It is a little bit because the growth, you see the growth. I'm going to be healthier. Healthier is not nobody goes to the gym to be healthier, to be prettier or go to the beach before the summer. But for disease care, the incentives, like where is the growth there? Where you truly feel the growth? And this comes to organizations and actually to people. That's why healthcare is so challenging.
Zaki?
Yeah, so I think that the 80% that learn, basically they first of all, they learn that they got to look at the market differently or at the problem differently or at their solution differently. So basically a reason why they fail, let's say, is the fact that they're stubborn and they don't really understand, or they fall in love too much with the solution they propose or with their interpretation of the problem. So I think one of the most important things I learned from you and you mostly is design thinking and empathy in approaching whatever it is you want to solve. And that should probably not necessarily guarantee success, but increase your chances of not only learning. Thanks.
Okay, so you talked about design thinking, and this brings me to the last question before opening for the audience. You know, Alex Center, this joint venture between Imperial College London and the Royal College of Arts established in the middle of St. Mary's Hospital. So they use this human-centered approach to medicine, in which they have researchers, clinical doctors, patients, technicians, artists, designers, all contributing to the final solution. Do you believe this is the future? Are you able to see this easily implemented in other places?
This is the present. Just not evenly distributed. Another quote, sorry. It's actually, if you look in, let's say, history of Silicon Valley, there has been a lot of input coming from people from different fields. And I remember very nicely behind the scenes, okay, Hollywood, also, at some extent, not very far from Silicon Valley. When they build a movie, they invite people from the university to provide philosophical / actionable feedback. For example, the Avatar movie has the guy that created Avatar language is actually a teacher of languages at the UCLA. So it should have been already happening a long time. And actually, once again, in startups, this is happening because a startup that does not have a multidisciplinary approach is almost doomed to fail. Thank you.
José Miguel, do you see this happening at our hospitals sometime soon?
I think it will not happen at hospitals. It will happen with these tools that we are giving hospitals. And so they will have it indirectly.
No, I'm a biomedical engineer, and I was just remembering one time I see a thesis defense of a colleague of mine that we had the supervisor from the engineering school and one from the medicine school, and in the end, his supervisor from the medicine school make a question like, "Oh, can you do this and that?" And the poor guy said, "My thesis is about this." And so it was interesting because you had this combination of an engineer and a medical doctor, but the medical doctor probably didn't perceive how that collaboration was happening at the point that he even communicated properly to the students. That it was much more interesting, this topic, than the other. And I think we see often more in the research sides of this decoupling of actually what is the real need to be solved and what is being solved. And again, for me, is a matter of incentives in the end, because sometimes it's good enough to win a proposal, but to deliver products, we really need to involve things and people to make sure you are solving the correct problem. And how you incentivize people to collaborate and create the framework is what you are describing. Was the setup for it to happen in a more systematic way is what we need to provide more. Because if you provided incentives, that will happen naturally.
Very well. So any questions from the audience?
Who wants to come to Cluj?
One question per person.
We have two there.
have medical professionals. What about including artists also in the development of technologies? Do you think that this is a possibility?
It's more than a possibility, it's a reality today. And apart from the examples that we were given, I think a more relevant, not necessarily more relevant, but a potentially more impactful one is the constitution of a new EIT, which is going to be focused around culture and creative industries, right? And, you know, being European Institute of Innovation and Technology, focusing on cultural and creative industries, you basically have all the ingredients there for what it's going to be a lot of multidisciplinary experiments, including arts. So I think we're on the right track with this. And I think it's also an unavoidable reality that we're going to face in the next year.
And I want to comment also on something. If you want your solution or what innovation to be successful, you need to have something called user experience. And for this, you need design. And you need actually not design, you need people that can actually understand the people and build things according to their needs, which is a lot of artists that are seeing the, I would say, the opportunities in influencing and connecting to people through their art. So if you want to recruit designers, you will recruit them at the art university, but of course, people that would care about how an app is looking like or how a digital health solution. But I don't know how the other founders are dealing with the design problems, but you need somebody at least with the artist soul, somebody that will fight you over the color or somebody that will fight you over the font.
Yeah, maybe I can give a little bit of insight how we develop any new feature at NOC. Basically, anything that we develop means 8 to 10 people in a room kind of for kickoff. And those 8 to 10 people, always, we have, of course, designers, engineers, people from product who may not be either of these, doctors, and a couple of other people who are usually managers just because you understand the client. And so sales, commercial management. And so this is always how we kick off any feature. And kind of then we already have kind of a typical process, which is very, very fundamentally the design thinking workflow. And we spend between 1 or 2 days scoping out anything with this. So kind of this is the definition of multidisciplinary. There's 10 people, 2 of each area, all putting their minds to coming up with something. And then of course we scope it, we evolve it, we produce some mock-ups, some wireframes, and then we go back to the same people and it's like, was it this that was discussed? And after all of that is kind of when we do the quality control, sign off, and when we actually start developing this feature. So I think this is literally already working, at least in companies that do some things right.
Like no.
We're lucky sometimes.
No, but looking for the ecosystem perspective that we have from eHealth is interesting when we look to the bunch of startups that we support. Of this concept that in healthcare is quite interesting, this patient innovation. And probably we have a hardcore patient innovation, but the truth is that we see often people that are not from healthcare. They are not probably the engineer, the typical that you find to be the founder. And that shapes often the innovation in a way in healthcare. It's quite interesting because everyone feels the pain of healthcare. So they get a lot of motivation because they struggle with their parents' situation or themselves. And those people often are artists or linguistics, and they bring a different mindset and approach to things. It's interesting to see how a lot of the startups are created from not a typical, it's not a doctor with an engineer, they get together and they make an amazing innovation. Often the story is not about that. It's about someone that really understands the issue and have a different angle into the situation. But on the opposite side, we still see a lot of work that needs to be done in the ecosystem. For instance, I mentioned the education part of eHealth. The truth is almost none of the innovation projects we supported, actually, they brought the linguistic department of their university into the project. So they bring this education piece into place, but they don't go forward and think, okay, how are you going to write the app text from what Zaki is building, that the linguistic is actually driving the adherence, the explanation, changing how you communicate the disease or the diagnostic to the person, using the leverage of the knowledge of people that are like doing PhDs and postdocs on linguistics, on the power of probably one sentence or one word can change the perception of people. We are probably not seeing this in a more systematic way on the projects, and probably this is like, let's do so. Often I speak with some of the people on our network of eHealth and say, like, this is what we need to do. Don't get stuck on your departments. Engage other departments in the universities, because we need more that kind of integration to happen in a more systematic way. And we often like, okay, the linguistic part probably is more important in an app than the app itself. The code is easy, like you get some developers, not easy but in that sense, but anyone can build it. The linguistic part probably is the essence part of what we are doing in the digital health part, is how you communicate. But we are still often not seeing that kind of components. More we see more in the design part than probably the linguistics. So this is a call for, let's think about it more and more, how this integration can be done, and bring those people that are not thinking healthcare solutions and technology into the loop as early as possible.
Okay, there was another no. So if there's, oh yes, okay. Last question.
I have to catch a plane, therefore I will run right now, and I'm terribly sorry for this.
Okay, so
Thank you.
let's give a round of applause to Zaki, who's going.
Is this on? Oh, yeah. So thank you. My question is maybe directed at José, who a few minutes ago was speaking of interoperability and patients taking ownership of their data. My question is, does not the European health data space, which is being discussed right now, maybe tackle that? And how do you feel about it?
Absolutely,
basically?
I'm a fan. If you look at Knox LinkedIn page today, we've posted something on European data space. Huge fans. Absolutely, I think it will address that. Although the financial part of it is much clearer in terms of the interoperability side and the mandatory part of interoperability than from what I understand about European data space at this time. But of course, and ultimately, the only way you give patients, and of course, this is a fundamental thing about healthcare. Every hospital does not want to give you your health data because they want you to keep visiting that hospital. So the first source of power to a patient is to give him free choice, which is something that today, as a patient, you do not have. And I'm as a super strong endorser of that. I hope, I'm not sure, but I hope it will really be a game changer in how healthcare is delivered, because it will knock down many barriers at the same time. But I'm super curious. And another thing that I worry is I see many countries doing independent, centralized electronic health records, which again is cool. But my question is, I tend to believe that the French EHR will not communicate with the German EHR and with the Italian EHR and with the Austrian EHR. There are 4 quite used. So you are building new hurdles to interoperability. And of course, there is a problem that startups are already working on very well, which is building middlewares so that any company can interoperate with any other company. But if you do it right the first time around, which is what they did on finance, that falls spontaneously. So that's why I think there is room to improve. But a super strong endorser of that.
If I can jump on this, because actually the European health data space is one of the flagships of the IT health topics, like trying to focus on how can we, as an ecosystem, funnel that. And we are having the discussion like 4 weeks ago. So we brought Estonia, how they're doing with data and so on. And I'll just leave a more personal comments because we get amazing presentations. And I think the European Health Data Space, we do amazing presentations about the technology, but I ask, where's the business? Like, where's the incentives network to make sure that people actually share the data? Because when you go to financial, that's the point. If there's money, things will work. And I think we are too often stuck with the communication protocols or the technology, and we don't think about the financial incentives for things to work. We still don't want to charge for data. There is like some kind of concepts that we don't want to explore. And the Americans in the US are much more upfront on these kind of things. At the point that they issue a new law about interoperability of data, that they left the standards out. So there was no specific standard because 80% of the market already uses standards. So naturally it evolved because the incentives, the money, the business was there. And it's a little bit, I'm just often like, I'm a little bit greedy on this environment and say, let's think about the money because the money drives a lot of the things. And in the European health data space, we still need to face, this is not a technology issue. Like, so just we need to build the incentives, the money, how the money will flow, and then things will align. Otherwise, we're just building silos, connected with silos, and then we do silos of silos. And in the end, probably we end with more silos that we had before. And that's maybe a challenge if you don't address the elephant in the room, on my personal opinion. So this is just a personal opinion, not the eHealth one.
I would like to also comment on this. Startups are extremely happy if this, not if, but when. Because now it's a matter of when this will happen, because it's going to be easier to connect for data to the European health data space than to connect to the hospitals in a specific region, because hospitals might need a lot of decisional power to do it. So that sometimes this is the way you solve problems in healthcare. You raise the problem to a higher level and somebody else is solving the problem. Thank you.
Thank you.
So we don't have, just want to for our brilliant speakers and I think we're going to have the closing remarks, right?
Very strong conclusions, but I want only to thanks to all of you. I have not been here to attend all this roundtable, but for the faces has been fantastic. And for sure, I want to thank to all of you to being here, of course, the speakers, and of course, the ones that attend this event. I hope this has been fulfilled for you, and thanks a lot. Okay, thank you.